Hi everyone, it's Lisa with livingwithasthma.net, and we are back with another of our Asthma House Calls, where we get to sit down and talk to some of the very best doctors who treat asthma in kids. Today, we're here with Dr. Maeve O'Connor. Dr. O'Connor is board certified in the areas of allergy and immunology. She's a member of the American Academy of Allergy, Asthma and Immunology, and she's also received the Patient's Choice Award and Compassionate Doctor recognition. Thanks for being with us, Dr. O'Connor.
Oh, thank you so much for having me. It truly is an honor.
Now, just to start, for those parents who haven't taken their child to an allergist for their asthma, can you tell us a little bit about what an allergist does and how you fit into a child's asthma treatment plan?
Oh, absolutely. With pediatric asthma, a higher percentage of asthmatics actually have allergies as the trigger for their asthma. And that can be anything from pet dander to pollen to dust mites, mold. Even sometimes foods can be a trigger for asthma. And so in order to take better care of allergic asthma, it's important to see an allergist who can do the appropriate testing to try to find the triggers for the patient's asthma, whether that's doing skin testing or blood testing. There's immunocap testing that's very sensitive and specific to find triggers, because with avoidance of allergic triggers, asthma can be better controlled. So, sometimes the patient will be diagnosed with asthma, given medication, and sent on their merry way. But if we know the triggers, and avoidance and or immunotherapy can be used, a patient's asthma can be better controlled with fewer medications. A lot of times, asthmatics have to be on inhaled steroids or even oral steroids. With knowing something as simple as what's triggering the asthma, we may be able to either avoid steroids altogether or minimize how much steroid we have to use.
What are
So
some
the allergist is very important.
Of course. What are some of the more common triggers that you're seeing for asthma these days?
Well, certainly pollen, tree pollen in the spring, grass in the summer, weeds, particularly ragweed in the fall or autumn. During the winter months, we see a rise of dust mite exposure because patients are spending more time indoors during the cold months. There's mold, which is all year round. Pet dander, cat and dog being the most common. I've been seeing an increase in horse allergy, guinea pig, even ferret. There's some families out there who have different animals in their homes other than cats and dogs, and it's important to test those patients to see if maybe one of those animals is a trigger as well. Also, at times, foods can be a trigger, creating wheezing in a patient with asthma if they do have a food allergy as a trigger as well.